On November 1, 2025, a quiet but profound crisis is unfolding across the United States. A federal government shutdown, now in its 34th day, has pushed the Supplemental Nutrition Assistance Program, SNAP, to the brink. SNAP, which feeds nearly 42 million Americans, faces an unprecedented funding shortfall. For 1 in every 8 people, this is not a distant debate. It's a direct threat to putting food on the table. Monthly benefits were scheduled to stop today, creating panic and desperation. While court rulings have offered a temporary reprieve, the system remains in jeopardy, leaving millions in limbo. In response, governors and state lawmakers are stepping up, unlocking emergency funds to create a patchwork safety net. This story explores why SNAP matters, the staggering numbers at risk, and how states are racing to protect their citizens. SNAP, or the Supplemental Nutrition Assistance Program, is America's most important anti-hunger initiative, reaching millions of people every year. It's a federal program designed to help those who are struggling to put food on the table, especially during tough times. By providing monthly benefits, SNAP helps low-income families afford groceries and make healthier choices at the store. It's a lifeline for parents who want to provide nutritious meals for their children, and for individuals who are working hard but still can't make ends meet. Recipients use an EBT card, which works just like a debit card, to buy food at authorized stores and farmers markets across the country. This system makes it easy and discreet for people to access the food they need, while supporting local businesses. 2/3 of SNAP recipients are children, seniors, or people with disabilities, people who are often the most vulnerable in our communities and need extra support to stay healthy. To qualify for SNAP, a family of 4 must earn less than about $31,000 a year, though the exact amount can vary by state and household expenses. This ensures that help goes to those who need it most. SNAP doesn't cover all food costs. It's meant to supplement tight budgets, not replace them. On average, benefits amount to just over $6 per person per day, so families still have to stretch every dollar and make careful choices. For many, SNAP is the difference between eating and going hungry. It helps prevent children from going to bed on empty stomachs and eases the stress for parents who worry about their next meal. SNAP is also responsive to economic downturns. When people lose jobs or face unexpected hardships, the program expands to help more families get back on their feet, providing a crucial safety net during uncertain times. Every SNAP dollar spent not only helps families, but also boosts local economies. It supports farmers who grow the food, grocers who sell it, and truckers who deliver it, creating a ripple effect that benefits entire communities. By reducing poverty and improving health, especially for children, SNAP is an investment in our nation's future. Studies show that kids with access to SNAP are healthier, do better in school, and have brighter prospects as adults. SNAP is a foundational support system, ensuring that no one in America should have to worry about their next meal. It's about dignity, opportunity, and the belief that everyone deserves a fair chance to thrive. The SNAP crisis is a direct result of the ongoing federal government shutdown. Without a budget, the USDA can't send out the $8 billion needed for monthly SNAP benefits. Political blame is flying in Washington, but families are left waiting in dread. Federal judges have ordered the administration to use emergency funds, but the solution is temporary and uncertain. Even if payments are made, delays are expected, and millions remain unsure when or how much aid they'll receive. The Senate has adjourned with no deal in sight, and the president's assurances offer little clarity. The shutdown has turned a reliable program into a source of stress and anxiety. The shadow of political failure now stretches across kitchen tables nationwide. Families who did nothing wrong are caught in the middle of this fight. Nearly 42 million Americans, 1 in 8, rely on SNAP, the Supplemental Nutrition Assistance Program, to put food on the table. For these families, SNAP isn't just a benefit. It's a lifeline, a crucial support that helps them get through each month. Without it, many would face impossible choices between paying for groceries, rent, or medicine. In states like New Mexico and Louisiana, the need is even more acute. Here, up to 1 in 5 residents depend on the program to keep their families fed. In rural towns and small communities, where jobs are scarce and wages are low, SNAP is often the only buffer against hunger. Most recipients are children, seniors, or people with disabilities, those least able to weather a financial shock. For them, a sudden loss of benefits can mean skipped meals, missed medications, and mounting anxiety about the future. These are our neighbors, our friends, and our loved ones. For a family of 4 earning less than $31,000 a year, losing SNAP is catastrophic. It can mean empty cupboards, children going to bed hungry, and parents forced to make heartbreaking decisions every day. The average benefit may seem small, just a few dollars per person per day, but it's the margin that keeps hunger at bay. For many, it's the difference between a balanced meal and going without. Food banks and pantries are bracing for a surge in demand, already seeing new faces, including unpaid federal workers and families who have never needed help before. Volunteers are working overtime, but resources are stretched thin. These organizations can't fill the gap left by an $8 billion federal program. No amount of local charity can replace the scale and stability of SNAP. The emotional toll is immense. Parents lie awake, wondering how they'll feed their kids, feeling the weight of uncertainty and fear. The stress ripples through entire households, affecting children's health, well-being, and ability to learn. The crisis exposes the limits of charity and the urgent need for a stable safety net. When government support falters, millions are left vulnerable, and the cracks in our system become impossible to ignore. The human face of this crisis is one of worry, fear, and desperate hope. But it's also a reminder of our shared responsibility to ensure that no one in our communities goes hungry and that every family has the support they need to weather hard times. In Louisiana, nearly 800,000 residents rely on SNAP. State leaders acted swiftly, authorizing $150 million in emergency funds to keep benefits flowing. Governor Jeff Landry emphasized protecting the most vulnerable, children, seniors, and the disabled. This bold move ensures most recipients continue to receive support, offering stability amid chaos. However, about 53,000 able-bodied adults without dependents are excluded due to limited funds. The decision highlights the immense financial pressure on states trying to fill a federal gap. Even with this intervention, some will fall through the cracks. Still, Louisiana's action is a lifeline for hundreds of thousands facing hunger. New Mexico, with the nation's highest SNAP reliance, faced an immediate crisis. The state deployed $30 million in emergency food assistance, distributed through the EBT system. This covers only about 30% of a typical monthly benefit and will last just 10 days. Lawmakers had already approved extra funding for food banks and SNAP administration, preparing for the worst. New Mexico's response is both heroic and limited. State resources can't fully replace a federal program. The emergency aid is a short-term bridge, not a long-term solution. State leaders are deeply connected to their people's needs, but the scale of the crisis is overwhelming. Even with creative solutions, the gap remains vast. New Mexico's efforts show both the strength and limits of state action. Louisiana and New Mexico aren't alone. States nationwide are scrambling to prevent a hunger crisis. Governors are expediting funds to food banks and pantries, reinforcing the charitable food system. Some states, like Nevada, are using EBT systems to deliver emergency aid directly and efficiently. These rapid responses show local leadership stepping up where federal action has failed. But the result is a fractured, state-by-state safety net. A family's access to food now depends on their zip code. This patchwork reveals the vital need for a consistent, reliable federal program. SNAP was designed to ensure no American goes hungry, no matter where they live. The real story of the SNAP crisis is found in the voices of those affected. These are not just statistics or headlines, they are the lived experiences of families, seniors, and children facing uncertainty every day. Their stories reveal the true impact of policy decisions, echoing through kitchens, living rooms, and community centers across the country. A mother in Louisiana checks the news daily, fearing how she'll feed her children if benefits stop. Each morning, she wakes up hoping for good news, but the anxiety never leaves. She plans meals carefully, stretching every ingredient, and wonders how long she can keep her family nourished if help disappears. An elderly veteran in New Mexico worries he'll have to choose between nutrition and his health. His fixed income barely covers his medication, and now, with SNAP in jeopardy, he faces impossible choices. For him, every trip to the grocery store is a reminder of how fragile his security has become. Even where emergency aid is offered, families face tough choices. 30% of a benefit doesn't cover the gap. Food pantries help, but supplies run low, and parents must decide which bills to pay and which to delay. The stress of not knowing what tomorrow brings weighs heavily on every decision. Parents are postponing bills, stretching every dollar, and living with constant anxiety. They juggle rent, utilities, and groceries, often sacrificing their own needs to shield their children from hunger. The pressure is relentless, and the fear of falling behind grows with each passing week. Communities are coming together, but the emotional toll is heavy, especially on children. Volunteers and neighbors do what they can, but the uncertainty lingers. Children sense the stress around them, and their smiles fade as they worry about their next meal. Food insecurity strains mental health and family relationships. Tensions rise as parents struggle to make ends meet, and children feel the weight of adult worries. The bonds that hold families together are tested by the daily struggle to survive. The hope offered by state aid is real, but it's only a temporary fix. For many, it's a lifeline that brings relief, but the uncertainty of the future remains. They know that true security requires more than a single check or a bag of groceries. These voices remind us the crisis is measured in fear and dignity, not just dollars. Behind every statistic is a person fighting to maintain hope and self-respect, determined to provide for their loved ones despite overwhelming odds. They want more than food, they want peace of mind. What they seek is the assurance that tomorrow will be a little brighter, that their children can grow up without fear, and that dignity and hope can be restored to every table. The SNAP crisis reveals a nation's true strength, its commitment to the vulnerable. State actions have been inspiring, but emergency measures are no substitute for a strong national safety net. SNAP was designed to provide consistent, nationwide support against hunger. When that promise is broken, hardship and inequality deepen. This moment calls for renewed appreciation and protection of programs like SNAP. These aren't just budget items, they're investments in our collective future. A strong safety net builds opportunity and resilience for all. Let's celebrate decisive state leaders, but demand federal responsibility. Keeping food assistance strong and free from political games is an American imperative. Our nation's future depends on the compassion we show today.